Understanding dental insurance terminology is super critical to make sure your practice is getting paid for the work you're doing on your patients. This video is for dental practice owners, dental receptionists, or any other front desk personnel who may be dealing with dental insurance on a day-to-day basis. If you've recently joined a dental practice or are thinking about transitioning to a career to work in a dental practice, learning dental insurance inside out starts with understanding the everyday dental insurance terminology that's used in a dental practice. If you're a practice owner thinking about hiring somebody new who's not from the dental background, or maybe you've already hired somebody new, make this video part of the dental receptionist training during their onboarding. Instead of listing out different dental insurance terminology, I'm going to give you examples where possible to kind of help you understand how it all fits together in the dental billing process. And stick around to the end because I'm going to go over a few examples of EOBs to bring some of this terminology together. So at this point, you're probably thinking, what makes me even qualified to speak on this topic? Well, I started my practice from scratch back in 2013. Coming out of residency and then having joined other dental practices as an associate, I had no knowledge of this dental insurance stuff. I had no idea how dental billing worked. In the first 4 weeks of starting my dental practice, I went through 3 different front office people. I hired them because of their experience because that's what they said on their resume. I had to rely on them because that's who I thought calls insurance companies, verifies their benefits, enters their claims, etc., etc. And I thought my job was only going to be focused on doing good work for patients. Well, I learned some difficult lessons very early on. I was so fed up with hiring people for their experience they listed on their resume because every single one of the 3 people that I worked with in the beginning, they dropped the ball in major ways. For example, one of them just did not know how to calculate the patient copay, even though we trained together with Open Dental when I started. The second one, I can't forget this, she just became so chatty with the patients at checkout that she would just forget to collect the copay. Even though it's been 12 years, some of these things you just cannot forget. The third one, she just ended up not showing up to work one day. Those were not the only reasons why I fired them, but I'm trying to keep focus on the topic for this video. And I decided from that point on, I would only work with people with no dental experience for the front desk, and that I would take my time with the hiring process. I learned everything inside out about dental insurance. I learned the whole process of dental billing, from verifying insurance benefits, entering the benefits into the patient's chart, into Open Dental, generating claims, entering claim payments, etc. Now, I call that the patient revenue cycle, the entire process from the point of the first interaction with the patient over the phone to actually getting paid for the services you've provided to the patient and to actually having the money land up. And before I delegated anything, I learned all of it. It's not rocket science. If you don't know the information, you can easily look it up. It's a time-consuming process, but you've got to put in the time to learn it once. But ever since then, I've only hired 2 front desk team members in the last 12 years. The first one I hired, again, had no dental experience, but she had amazing work ethic. She was open to learning, so I trained her on everything I knew about dental insurance and also how to use the software to help her with her job. She eventually had to move, so 6 years later, I ended up hiring another front desk, also with no dental experience. But 6 years later today, she's still with me today and running the whole operation herself. We work together pretty well since I'm also very hands-on with all the administrative stuff that's going on in the office. In fact, she's also been an inspiration to me creating these videos because I wish I had these videos around to show her when she first started. So as I make this video, I'm doing it from this lens of how do I show someone watching this video exactly what I was teaching her when she started. So I've done it twice, and I believe I've done it successfully because all of the administrative work for the office is now delegated to her. All right, let's get right into it. By the way, if you haven't seen my previous video that I did on terminology that's used on a daily basis for the business aspects of the practice, it will be helpful since I cover a few of these insurance terms that we use on a daily basis. To help you, I've also included a printable PDF of the dental insurance terminology that we're going to discuss in this video, along with images that you'll be able to reference while you're working. And the link to the PDF is posted below this video. So let's start with the term that gets thrown around a lot, dental billing. So what is dental billing? The term dental billing is usually referred to practices that accept insurance, but it's also relevant for fee-for-service practices that are not in network with the patient's insurance, but may be filing paperwork for the patient's behalf to get them out of network benefits. Think of the whole process of dental billing as this complete cycle with steps in between. And the first step would be the pre-appointment process for a new patient that wants to come in for an appointment. And that process would be dental insurance verification. In order to present treatment costs to patients when they come in, you need to know what their benefits are. The way to systematize and streamline this entire process of dental insurance verification is to follow a template for every single new patient. I won't get into the details here, but I have 2 specific videos on this topic. In this first video, I go over step by step how to do insurance verification for patients. You'll also be able to download a template which you can follow or customize to your office needs. In the second video, if you happen to use Open Dental in your practice, I cover the best practices with Open Dental when it comes to insurance verification. The second step in the dental billing cycle would be attaching the insurance information you receive from step 1 into the patient's chart. And this information goes into the practice management system that you use in your practice. This step is crucial because it's going to help you determine patient copays once a treatment plan is entered into the system. Once the patient is in the office, whether it's for exam or a preventive visit, or if it's for any work that they need, a claim is generated for the service. And that's the third step. And of course, before the claim is sent, correct procedures should be attached to that claim. The fourth step would be sending the claims and the attachments. Once all the claims are generated for all the patients for the day, the claims are batch sent to the insurance companies. Now, depending on which third-party software you're using for claim submissions, it's going to notify you of attachments that certain claims may need. The attachments are basically supporting documentation the insurance companies require for processing of the claim. And these attachments may be in the form of intraoral photos, periodontal charting, dental x-rays, copies of EOBs, etc. The fifth step is entering the claim payments. Once you receive a claim payment, either in form of a check, a physical check, or electronically, the claim must be marked received in the practice management software. The sixth step is collecting patient balance. When the patients are coming in for work, you're supposed to collect copays at time of service. Some offices choose not to collect anything from the patient and they're simply going to wait until the insurance pays. Once the insurance check comes in, then a statement is generated to collect the patient portion that they didn't pay at the original visit. If the insurance pays less than what you expect, or they end up not covering what you thought was going to get covered, there's going to be a balance on this patient's account regardless. And this balance must be collected from this patient either by sending them a statement by physical mail, following up with them through phone calls and collecting via credit card, or sending them a text and collecting pay via text. So that's essentially the entire process of dental billing. There are a few smaller steps in the middle, of course important. What if a claim has been sent and the claim payment hasn't come in and it's already been over 30 days? At this point, someone in the office needs to be following up on outstanding claims. Outstanding meaning claims that have been sent out but have not been received yet. All right, let's move forward to more terminology. Annual maximum. What is annual maximum? Annual maximum is the total dollar amount an insurance will pay for a covered individual in a given benefit period. So let's say a patient's insurance has a $1,000 maximum. The insurance will pay up to $1,000 for services like cleanings, fillings, extractions, etc. There are some plans that don't count preventive services like exams, cleanings, x-rays towards the patient's maximum, which is nice for the patient because what would have been used towards preventive services can now be used towards any work that they may need. After the benefit period ends, which is most commonly calendar year, it will once again renew and the patient will get another $1,000 for the new benefit period. Benefit period, or sometimes referred to as benefit year, is basically a 12-month period an insurance plan covers for an individual. It's most commonly calendar year, but it could also be something like July 1st, 2022 to June 30th, 2023. So when your team is verifying dental insurance, you need to find out what the dental benefit period is for that plan. Effective date is the date insurance will start paying dental benefits for the plan. But just because the effective date is in place, don't just assume the patient is going to have benefits right away, because there may be something called a waiting period on this plan. Waiting period. Waiting period is the amount of time the patient has to wait before the insurance starts paying dental benefits. And this is after the effective date of the plan. Different plans are going to have different waiting periods. Some plans have no waiting period. Even if the plan does have a waiting period, it may not apply to preventive services like cleanings, exams, and dental x-rays. Some plans have different waiting periods for different services. For example, simple restorative things like fillings may have a waiting period of 6 months, whereas major services or major restorative services like crown and bridge work, there may be a 12-month waiting period. If your patient gets work done during the waiting period, your office is just not going to get paid. So it's super important that your team, when they're verifying dental insurance for this patient, they find out what the waiting periods are, or if there is any waiting period. Deductible. Deductible is the amount of money the patient must pay out of pocket before the insurance pays anything towards the covered procedure for the benefit period. Let's go over an example of how a deductible is used to figure out how much insurance is actually going to reimburse towards the procedure and what the patient is going to owe out of pocket. So here's an example for just one procedure. Let's assume the treatment plan is for a 3-surface composite filling on tooth number 2. D2393 is the code for the 3-surface filling. Here are the details for the patient's insurance that you verified during the insurance verification process. The deductible is $50, which the patient has not met yet. There's 80% coverage on restorative services. And there's a downgrade on posterior fillings, which means the insurance is going to downgrade composite fillings to amalgam fillings. What this means is that when you send in the composite D2393 code, this specific plan, Cigna, will downgrade that code to D2160 and calculate the reimbursement based on the allowable fee of $109 and not $166. So how do you calculate the insurance reimbursement from this information? So you take the allowable fee for the downgrade code, which is $109. You take away the deductible of $50 from it first, since it hasn't been met yet. And that gives you $59. 109 minus 50 equals $59. Since insurance is covering 80% of restorative, they're going to reimburse $47.20, which is 80% of the $59. Now, what about the patient? What's the patient going to owe for this visit when they come in? And that's what's referred to as co-insurance. This is the percent amount the patient has to pay along with what the insurance is going to cover. For this example, remember, you're going to do a composite, which is D2393. That's the code that's going on the claim. So from the allowable fee of $166 for that code, the insurance is going to reimburse $47.20 as we just determined. This leaves the patient out of pocket of $118.80. It's super important that you understand this concept. You're not going to do this manually for each procedure on the treatment plan because the practice management software that you're using in your office is going to calculate this for you. But for that to happen, that's why it's important for you to attach correct insurance details to the patient's chart in the system that you got from the insurance verification process. Let's keep going. Negotiated amount, or the contracted fee. This is the fee the dentist has agreed to with the insurance company as a payment in full for a covered service. This is also referred to as the allowable charge or the maximum allowable charge. For example, if you're contracted with Aetna, for example, and your in-office fee for a crown may be $1,500, but the Aetna contracted fee, let's say, is $800. The maximum you can charge to that patient is $800. Submitted charges. This is the term usually used when you're reading EOBs or estimate of benefit statements that you've received from insurance companies. Submitted charge is the fee that your office submits for a procedure for which you're filing the claim. And usually the submitted charge is the office fee. Here's an example EOB from Emeritus Insurance, which shows the submitted charge, which is our office fee of $1,878 for the crown. Right next to it, you see the column for eligible charges, which is really just the negotiated fee with Emeritus for that procedure. Here's another EOB from Aetna showing our submitted charges, which are office fees for post-core and crown. Right next to it, you see the negotiated amount, which is really our contracted fee with Aetna for those procedures. Primary and secondary insurance. This is when a patient is covered by more than one dental insurance. A patient may have their own insurance from their employer, but they may also be covered by their spouse's dental insurance. Which insurance is primary and which one is secondary is determined by something called coordination of benefits. When a patient is covered with more than one plan, the two dental insurance companies will coordinate the benefits for this patient. And there are rules when it comes to coordinating the benefits. The plan the patient gets from their employer is their primary insurance, and the plan they get from their spouse is their secondary insurance. For dependent children, the birthday rule is used for parents living together or are married. Now, what this birthday rule means is that the dental plan covering the parent whose birthday comes first, specifically the month and the day comes first in the calendar year, that plan will be the primary plan, and the plan covering the parent whose birthday comes later in the year will be the secondary plan. There are other scenarios you need to keep in mind. For instance, what if a patient has a COBRA or a retiree plan? What if parents are separated or divorced? And what about Medicaid plans? Instead of trying to memorize these scenarios, we like to rely on ADA's guidelines on coordination of benefits, which I'll link to at the bottom of this video. All right, let's keep going. Alternate benefit code or alternate benefits. I briefly touched on this earlier when I was showing you the example of deductible, how the insurance downgraded the composite filling to an amalgam filling. The alternate benefit clause means is that if the dental insurance thinks there are 2 or more professionally acceptable dental procedures that will work for the dental condition, they're going to pay for the least costly procedure. And that's what's referred to as the downgrade, and this happens in many plans. For instance, if you're submitting for a patient for implant or a fixed denture, or like a 3-unit bridge, the insurance comes back and downgrades it to a partial denture. And now the patient is left to pay the difference between the alternate benefit of a partial denture and the actual implant or a fixed bridge contracted fee. This kind of financial surprise can usually be avoided by sending in pre-authorizations for major work, which is exactly what I do in my practice. Assignment of benefits. This is when a patient authorizes the dental insurance company to forward a payment on a claim directly to the dentist. This should be the default setup in your practice management system. Predetermination. This is a statement from the insurance company stating what they're going to pay on the procedures you filed on a predetermination claim. The statement is going to indicate if there's going to be any downgrades on the procedures you filed on the predetermination claim, if there's any deductible to be applied, what the insurance reimbursement is going to be, and what the patient is going to owe out of pocket. Predeterminations are not a guarantee of payment, and the insurance companies are clearly going to indicate this on the predetermination EOBs you receive. But what this really means is the estimate that they're quoting you is subjective to the plan, meaning at the time you complete a service and you file a claim, at that point, patient should not have been maxed out on their dental plan, meaning patient should have benefits remaining on their plan. I won't get into the details here, but I've actually written 3 detailed articles on predeterminations and exactly how I deal with them in my own practice, and I will link to those articles below this video. From the post on what you need to know to avoid insurance delays, you'll be able to download a PDF that goes over a chart that explains the important x-rays and documentation you need to submit to the insurance to avoid delays. And when you're going through the best practices article, I've also made available for downloads different narrative templates that I use in my practice for things like post-core crown, replacement crown, new fixed bridges, replacement bridges, extraction and bone grafting, etc. All right, let's keep going. EOB. The EOB is referred to as the explanation of benefit. It's a paper or electronic statement that you've received from a dental insurance company once you filed a claim for the patient. The EOB is going to list any treatment performed, procedures that are not covered, what the insurance is going to pay, what the patient's going to owe, the deductible, etc. The EOB you're looking at on the screen is for a fixed bridge from tooth number 29 to 31. You can see the submitted codes for each line item. The submitted charge column shows my office fees. The approved amount is the contracted Delta dental fee for these codes. The column that says amount used for benefit calculation is the fee for the alternate benefit code Delta Dental has decided to downgrade to for each of those codes. This is indicated by the last column titled Processing Policies with a number. And what that number means is written at the bottom of the EOB. Basically, it means they're downgrading to an alternate code. Let's look at another example EOB. This one's from MetLife. This EOB is from the patient's preventive visit when they came in for a periodic visit, pro fee, and x-rays. Once again, you're seeing the submitted charge, the negotiated fee, the allowed amount, when the insurance paid, and also what the patient owes for that visit. Most EOBs show the same information, but they may use different terminology, which may mean the same thing. All right, I hope this was helpful in getting you started in the world of dental insurance. There are topics and terms I can spend an entire video on talking about that topic, like EOBs and primary and secondary insurances. Again, if you need a written list, you'll be able to download a PDF that includes all the terminology I've discussed in this video for you to reference later. And the link to that PDF will be posted below this video. If there's any confusion or you have any questions, I always recommend for you to leave those questions as comments below this video, because it's going to help other viewers who may have similar questions. Thanks for tuning in, and until next time, take care.